I think, as all obstetric providers know, the RSV virus is one of the leading causes of infant severe respiratory disease. And so it's really important to get our patients vaccinated.
I remind my patients that this is a seasonal vaccine, which they should get between September 1st to January 31st, so that they can make sure they time their administration of the vaccine to be between 32 and 0 to 36 and 6 weeks gestational age.
Within that window, they should remember that if there is a planned delivery that's going to be 2 weeks after their vaccine, then that's not necessarily enough time. Because the way that the vaccine works is that you produce antibodies after the vaccine is formed, and those antibodies pass on to your newborn, and so you want to give enough time for that. When I speak to colleagues and OB providers about vaccination for RSV and pregnancy, that timing is incredibly important, 32 to 36 and 6 weeks of gestation, and that really you only need one vaccine. If there's a subsequent pregnancy, right now we don't have the data for a second vaccine, but there's no safety signal there.
I do think it's important to remind the patient of that as well, because we are reminding patients about getting several different vaccinations at around the same gestational age. So patients should know that they should get their flu vaccine, their COVID vaccine, they should get their Tdap, and that they can also get their RSV vaccine at the same time. And there does not need to be any spacing between the vaccinations. Sometimes patients ask about spacing between the vaccinations. What we can tell them is that there is no known amount of spacing that needs to be done. It's whatever they feel most comfortable with. But to remember to get it between that gestational age that we recommend.
The most common side effect is pain at the injection site, but some patients can experience headaches or nausea or the symptoms like that.
The same side effects that they would get with most vaccines.
As maternal-fetal medicine docs, we take care of high-risk pregnancies, but I think it's important for everyone to know that if you take care of high-risk pregnancies, low-risk pregnancies, or any pregnant people, that they can get this as long as they get it in that correct window.
We know that when patients' clinicians recommend things like vaccinations, it gives patients much more comfort and they're much more likely to do the vaccinations that we recommend.
So there really are multiple options for a patient who wants to get this vaccine, because if they can't get it in their OB provider's office, they can get it in pharmacy, they can get it in local community areas that might be distributing this vaccine. So there's a lot of options for that patient.
What I recommend to the OB providers is that they can give the patient a note or a prescription so that the patient can receive the Abruzvo vaccine. And specifically, we want our patients to receive this vaccination because it's the only FDA-approved vaccination in pregnancy. What also shouldn't be forgotten is that the reason patients who are pregnant get this vaccination is so that they produce antibodies to then give to the baby so that the baby is protected for the first 6 months of life. So you're not necessarily only protecting the mom, but really and truly this vaccination is given to help protect the baby after delivery.